Hormone replace therapy will not work properly if you're not dialed in with your nutrition. It just won't. Nutrition and training. I've seen women getting on estrogen and feeling worse. Why? Because once again, we go back to the liver. The liver is not detoxifying properly. The pathways, they are not releasing, it's not releasing the bad estrogen, the estrogen that we need to release from the body. And now they have the estrogen circulating in their body and they are taking estrogen. Does that make sense? So they are more foggy. And I'm like, okay, girl, we gotta optimize this thing first. Your liver has to be, that inflammation has to come down in order for the hormones to work properly. You know?
I started at spine and pain conferences. I started noticing about 20 years ago, 2006, some of the physicians that are also pharmacologists. So they were pharmacists and also physicians. They were lecturing to a group of pain physicians and spine doctors. And I started noticing them about 20 years ago saying, hey, we've got to start looking at some of these precursor hormones because we can't just keep giving our patients opioids. I mean, the opioids don't work anymore. Their endocrine system's so messed up. And I can remember a very famous physician his name is Forrest Tennant, and he was a pharmacologist and a pain doctor. And him saying, look, we've got to start prescribing some of these, and again, I'm not a prescriber, to start prescribing some of these hormone precursors like pregnenolone and DHEA and some other hormones, because the opioids we're giving our patients are destroying their endocrine system and they don't work anymore. And so, one of his messages was, listen, the anti-aging docs have done a lot of research with some of the hormone replacement stuff. Don't be afraid of it. That was a message he was giving 20 years ago. He's since passed. But it's nice, even non-physicians, women that are coaches are helping other females get past that outdated, be scared of hormone replacement therapy. I love that.
But once again, how are you gonna know what to prescribe if you don't do a
blood
work?
You got to be looking at chemistries and
you
blood
got
analysis.
it, right? And that's the other thing that I'm seeing right now, women going to doctors and it's a 5 minutes consultation on a topic that you need at least 30 minutes just to get the hang of it, and they are just asking for your symptoms and prescribing just off of your symptoms. I understand if you're a woman that you are having debilitating hot flashes, we know for a fact you have no estrogen, so okay, I get in that point, but sometimes just a DHEA, right? Just can actually support, right, as a precursor for testosterone and progesterone. How are we gonna know if we don't test? So I'm just obsessed about testing first.
Yeah, well, that's great. I'm very reticent to recommend supplements to my patients because I've been doing it for 40 years. You're right. We should be measuring blood chemistries.